Everyone. We're excited, and thank you for all of you for being here tonight. We're very excited about the idea of kicking off this project called the Recognition and Response to Postpartum Preeclampsia in the Emergency Departments. This is our kickoff webinar. We hope to keep it short and sweet, but very informative. We've got a very exciting group of presenters tonight and a lot of information to pass on to you. And we'll leave some time at the end of the presentation for questions and answers. And so this is the project that's sponsored by the Texas Collaborative for Healthy Mothers and Babies. This is a quality collaborative project. And we'll go to the next slide. And so what I want to do is introduce our speakers. Next slide, Mercy. My name is Dr. Hill. I'm the TCHMB OB co-chair, and you'll hear later from my other co-chair, Gloria Delgado. I'm also the OB co-chair for this particular project. In addition to that, my other duties include I'm the chair of the OBGYN department in the Children's Hospital of San Antonio in the Baylor Department of OBGYN. And I'm also a maternal fetal medicine physician. My other presenters tonight, Gloria, who I mentioned earlier, is our OB co-chair. She's also the Assistant Administrator of Women's Services in the great city of El Paso. And then Lolly Perry, who is also a faculty member and on the TCHMB OB committee. Lolly is out of San Antonio. She's an outreach nurse educator, and she is also a perinatal and neonatal program educator at the University Health System in San Antonio. Next slide. So if you could just do me a favor, for those who are joining tonight, if you could just place your name, your particular role, and your organization in the chat box. That way that will give us an opportunity to get to know you a little bit better and ensure that we give you credit for participation in tonight's webinar. Next slide. So here's the agenda for tonight. Of course, I mentioned the folks who are going to be our presenters tonight. I'm going to talk a little bit about the project's work group, and then I'll turn it over to Gloria to give you a little bit more details about the project itself and some of the activities that we've done to prepare for this kickoff. And then Lolly will join her afterwards to talk a little bit about the structure of the project, get into a little bit more detail, sort of a high overarching detail, a description of the project in terms of its structure. And then I'll come back and go over the specific timeline to kind of show you where we are in kicking off this project and where we'd like to be in the next 6 to 12 months. And then again, at the end, we'll have some time at the end for questions and answers. Next slide. So this is a pretty robust work group. This is our postpartum preeclampsia work group. You can see from the screen, we have a number of folks that I just mentioned, Lolly and Gloria. There are also folks here from TCHMB staff. We have a lot of experts from previous projects, TCHMB projects. And then we have experts from the emergency department. There are a number of physicians that are part of the work group. And then least but not any less important is you got to have someone who understands QI. And we invited Sue Butts. She's been with us since the very beginning of this whole thought process. And she'll be available at the end for those who may be intimidated by QI. Sue will be there to answer any of your questions. And so I think that this will be a very robust discussion for us at the end if you do have questions about how that all fits in. And then my co-chair, Dr. Chari, who's an emergency department physician. Next slide. And so I'll turn it over to Gloria, and she'll talk a little bit about the background and more specifics about the activities for this particular project. Gloria.
Hello, everyone. My name is Gloria Delgado. I'll be presenting the background and activities. Perhaps some of you are aware of this statement already, but I'm going to go ahead and read it all. So the problem statement, and I'm sorry, I have my notes on the bottom too, so I'm going to be looking at you and then looking down here, okay? So of the pregnancy-related deaths reviewed by the 2020 Texas Maternal Mortality and Morbidity Review Committee and Texas Department of State Health Services, joined by annual legislative report, 11% have preeclampsia and eclampsia as the leading cause of death, and 50% of these deaths occur between the 40 days of delivery. If preeclampsia and eclampsia have been diagnosed and treated early, all of these deaths were potentially preventable. Non-Hispanic Black patients have a significantly higher rate of delivery hospitalizations involving hypertensive disorders. In 2019, Texas PRAMS found that 14.79% of Black and 15.14% of Hispanic patients have no postpartum checkup compared to 5.67% of white patients. So the opportunities identified are as follows: emergency healthcare providers, emergency health providers, knowledge about maternal physiology and health management, as well as communication and coordination with obstetric and women's health professionals can be a critical factor in maternal health outcomes. Next slide, please. Okay, I'm going to go over the project goals, and I think after that we have a poll. So the project goals, the project seeks to reduce maternal morbidity and mortality related to severe hypertension in postpartum patients by, number one, identifying postpartum patients presenting to the emergency department with severe hypertension or preeclampsia. Number two, treating patients identified with severe hypertension in a timely fashion. Number three, improving communication and coordination of care between emergency medicine and obstetric healthcare teams. Number four, reducing complications from postpartum preeclampsia that led to maternal morbidity and mortality. Number five, reducing racial disparities in health outcomes of Black and or Hispanic postpartum patients with severe hypertension or preeclampsia. I think, are we doing the poll at this moment, ladies, or just keep going? Oh, there's the poll. Okay, so do you have a way to identify postpartum patients in the ED upon admission? Please, if you can answer, I think you can click on from your computer and then just submit. And we'll give you a few minutes so we can get the results. The results in here. 55% of the attendees said yes, 31% said no, and 14% said not sure. I'm gonna close. Can you close that poll, Mercy, please? No, we can close. Okay, next slide, please. So we will accomplish this by providing education to emergency department clinicians, improving processes related to recognition, diagnosis, and treatment of hypertensive disorders, facilitating improved communication and collaboration between emergency and maternal departments, developing and disseminating clinical management tools for emergency department clinicians. Next slide, please. So for the people that is going to be collaborating, I don't think we have a poll yet. Oh, I'm sorry, we have a poll, right? Do you want to do the other poll question? Yes, I'm sorry. Yeah, I skipped it. Do you currently have strong communication and collaboration between the ED and OB on postpartum patients coming to the ED? So the answer is yes, 47%, 50% said no, and 3% said not sure. So this project is really going to help to all of us so we can collaborate better with the ED. And those that already have collaborations, we're going to get it stronger. So collaborators and benefits. So for all the postpartum people, we're gonna help them by, we're gonna save lives and prevent harm from severe maternal morbidity due to hypertension, preeclampsia, or severe preeclampsia, or severe hypertension, I'm sorry. To include heart attacks, stroke, renal function impairment. So, that's how we're going to help our patients. Collaboration with emergency medicine providers and emergency centers. The benefits will be to support with improving processes, participation in a statewide learning community to improve birth outcomes and reduce disparities, connection to expanding statewide network of peers. When we collaborate with the ED, collaboration between the ED and OB departments, the benefit will be optimized collaboration to improve care and outcomes. Collaborators with the RAC, PCR Alliance, TCHMB Obstetric Committee, Texas Department of State Health Services, and TCHMB partner organizations. The benefit is the recognition for championing cultural maternal safety and Texas aligning work in Texas. I don't know, we went to this. Can I continue with my slide? I'm gonna continue with my slide while they bring it back, okay? Collaborators with the hospital administration. The benefit will be connection to expanding statewide network of peers and decrease unnecessary hospital admissions. So I think we're moving on to the next activity, which is getting to know your colleagues. And you're gonna be placed in a random breakout room. There's gonna be some people in there. We said 2 to 3, but it might be more people. And so you're gonna have 5 minutes to say hello and to share with each other one thing you are most hoping to get from being part of this initiative. So we're gonna start with our breakout groups. Okay, very good. Welcome back, everyone, from your groups. We're gonna continue with the presentation. This slide is showing the enrollment information up to date to September 22nd, and this goes by the racks. The bottom part is the rack. I don't know, your rack letter. So that's the enrollment that we have. So from rack Q we have 5, E we have 4, B we have 3. C, 2, I and P, they have 2, and B and T, they have 1. So we can go to the next slide, please. The next slide is showing us by maternal level of care and then by the size of the hospital, the number of deliveries, live deliveries. So on the left side, we have the levels of care, and we have 1 for a level 1, we have 7 for level 2, 8 for level 3, and 4 for level 4. As far as the number of deliveries of the size of our hospital, most of our hospitals are medium size. And the next slide, I think, is that introduction for Lolly, who will be presenting the project structure. Thank you, everyone.
Hi, thank you, Gloria. My name is Lolly Perry, and I'm going over the project structure for this program. So we have 2 aims. We have a short-term aim, which is by September 2023, emergency departments will increase patients screened for postpartum status and for elevated blood pressure, that being a systolic greater than or equal to 140 and diastolic greater than or equal to 90 with symptoms of preeclampsia by 50% of hospital baseline. In other words, we want to increase our screening by 50% of women with postpartum status. Long-term, by September 2023, the reinforcement cohort hospitals will increase joint emergency department and OB unit case reviews performed for cases of postpartum patients with elevated blood pressures, as we stated before, the 140/90 greater than or equal to, presenting to the emergency department. Again, we want to increase these reviews by 50% of baseline. Next slide. So our cohorts, we have a reinforcement cohort, and these are the cohorts that are enrolling. Those of you who are enrolled, you'll be part of the reinforcement cohort. We'd like to have at least 1 hospital from each of the 22 perinatal care regions, Region Advisory Council Alliance. So of those 22 perinatal care regions, we want at least 1, but we will we're not limited, I guess I should say, to just 1 hospital per PCR rack. Any hospital wanting to join the reinforcement cohort can do so. I noticed someone had in the chat that they wanted to join, and yes, please do. We encourage you to. So that cohort will use quality improvement methods and tools to conduct or mentor other hospitals through testing processes and implementation of better practices. And they will be participating in monthly reinforcement calls. They will assist TCHMB during our project workshops at Texas A&M Learning Sessions and develop and share tools, materials specific to recognition and response to postpartum preeclampsia and ED. We'll check in periodically with TCHMB QI nurse to update and receive technical assistance as needed. The other cohort will be all the other Texas A&M participating hospitals, and they will receive support through the Texas A&M Learning Collaborative. They will have access to all the developed tools and materials, and they also will receive technical assistance upon request. Next slide. So we'll be having webinars, data collection, reporting, teams getting ready. So in January, we're going to start in January with monthly reinforcement calls to address important PPED content, quality improvement tools, and methods to carry out the work, opportunities for teams to learn from and share with each other, continuing through April. Through the project end, we'll continue, but we'll be having these reinforcement calls January, February, March, and April. On the next slide, we'll see the support team calls. Next slide. So support between these monthly calls, we'll have regular office hours that will be optional calls scheduled on the second and Thursdays of the month. We'll have the QI nurse available for check-ins and technical assistance, feedback on data, and feedback on use of your PDSA cycles. If you need any help working with those or going on to other cycles and testing and learning from them, we have experts to help you with that. And these are the links to resources and communication. Always feel free to use your Basecamp to see what's going on there. We have the latest updates and slides on Basecamp. Next slide. So of course, it's all about data collection to see if we're getting better and we're doing what we aim to do. So the reinforcement cohort hospitals will provide de-identified patient level data through the TCHMB REDCap. That is how we will provide our data. It's to inform improvement. So we see how we were doing. Hospitals can access to track their own improvement and to compare to the group at large. This data will be shared for the hospital's PCR RAC region for purposes of seeing if the changes are resulting in improvement. And we hope that they are. We're banking on it. So webinar on data collection and reporting is to begin on January 19th, 2023. I think that's it. Thank you.
Thanks, Lolly and Gloria, for that detailed information. I think there will probably be a lot of questions that we can answer once we get done with this next session. So let me just kind of go through some key dates and kind of look at where we are and where we're going. Next slide. So here we are, the end of September. And we're kicking off this particular project. And so what we hope to do next month is for those hospitals who are enrolled to send you out the orientation packet. And we'll talk a little bit more detail about what that packet will include. And some of, I think, Gloria and Lolly mentioned earlier. And what we'll do is we won't just kind of leave you high and dry. We'll have another webinar in December to kind of go over the contents of that orientation packet, because there's a lot of information in there that you may have questions about. We just want to make sure that we address all of those questions prospectively, so that, you know, again, we're not leaving you with a lot of information that you don't quite understand. And then I think we've talked about this before, and we can talk about this in a little bit more detail if you have questions, but there's a race equity webinar that's available. I think the dates are the 9th and 10th of November. It's in the evening from 5 to 7 p.m. Central Time. And we can put information in the chat box for you if you haven't received information on how to get registered for that webinar. And then in November, some of the volunteer hospitals will be testing data collection and reporting. We'll talk a little bit more about that in the Q&A session. And then the other two webinars that are coming up, one in December. Again, I mentioned that's when we'll talk in detail about the orientation packet. That'll be on December 8th, again in the evening from 5 to 6. And then the last webinar before we actually start getting into the real nitty-gritty of the project will be in January, on the 19th of January. I think that will be a very important webinar where we'll get into the details about REDCap. And some of the information about REDCap and data collection will be in that orientation webinar, but we'll talk about the meat of the data collection and how to get it submitted in January, and then hopefully start submitting data in February. Next slide. So I think there's some key things I think you should sort of take away from this and to sort of help you get the most from this project. Next slide. I think the most important thing is to now sort of identify who should be on your team, right? So who are the right members of your team? And I think you've got to get buy-in from the senior leadership. You got to figure out who's going to be on your team. That is, folks who you will be involved in this project on a day-to-day basis. Those who have content expertise, right? So someone in your organization has QI expertise. Again, Sue Butts will be there. We'll have some after-hour calls where you can call in and talk to anyone. But if you got somebody who's real strong in data, someone who's real strong in QI, then I would go ahead and identify those folks early on and ask them to join your team. And then start getting together with those team members, right? So, and identifying roles and responsibilities, and then how frequently you are to meet before we kick this thing off in January. And then explain to your leadership why this is important. Why do we need, you've seen from the poll, why is there a need to have good collaboration between the ED and your OB unit? And then I think the other thing that's critically important is to look at where you are right now, right? So what is your baseline data? I mean, how many times are you able to communicate with your OB colleagues, or how many times are you missing the opportunity to identify preeclampsia in the postpartum period? And even as the first poll, we talked about, you know, do you have a good way of identifying patients who show up into the ED who may be postpartum or may be pregnant or maybe have been recently pregnant, and sort of get a feel for where you are and where you need to be by January. And then, as I mentioned on the timeline just a few minutes ago, look at those key dates, put them on your calendar. This webinar will be recorded, so you can go back and get those dates if you missed it. Ask us in the Q&A session. We'll go back over those dates if you need it. Next slide. So mark your calendars. Here's some key dates. You can write them down. I'll give you a few minutes to look at them. But again, this will be a recorded webinar, so you can go back and get these dates later. I talked about the race equity training webinar. I think that's critically important. The next three webinars, one in December, there'll be one in January, and there'll be one the other one will be in January, I'm sorry. And then as Lolly mentioned, there'll be some reinforcement calls in January. So again, we're not going to just throw you out into the wolves and let you go about doing your own thing. We're going to have opportunities for you to call in and say, hey, I need some help. I need some better understanding of that. And we'll have those office calls even in February when we kick this off. There'll be the second and fourth Thursday of each month, all the way until the end of December of 2023. And then on March 15th, that's the deadline for submitting data for the month of February and January. And typically that data submission will be the 15th of each month from that month going forward. Next slide. This is sort of a good checklist. You can get you a copy of this if you want to, but this would be an idea. It's not all inclusive, but it talks about some of the things I mentioned previously about how to get off to a good start. And I think it's important to attend the webinars. And if you can't make the webinars, at least go back and look at the webinars that are recorded. And then one of the things I think we've had a lot of questions about in the last few weeks is about REDCap. We'll go over that in detail. This will be, you won't have your own, you don't have to go in and create your own REDCap account. We'll create a REDCap account for you that will be a TCHMB REDCap. We'll give you all that information, account number, login information, so forth and so on. So don't be intimidated about not knowing or having ever not used REDCap. We'll work through that with you. Next slide. And so I do want to acknowledge our partners, specifically the RAC PCR Alliance that's sort of helped us bring everyone together. Many of our OB committee members who have been with us week after week. We've been doing this, seems like a couple of years, although it's only been a few months. Members of our PPAD project work group, our hospital partners, our community collaborators, and all of our TCHMB partner organizations. Next slide. So I think I'll stop there, Mercy and Nagla, and talk a little bit about the format, if you would, for the Q&A session.
Anybody who has a question, if you would like to raise your hand, and then you can go ahead and ask the question, or you can ask it in the chat.
And for those of you who are driving or walking, we did put the dates that I just mentioned in the chat box. I'm sorry, we put our website, the TCHMB website, in the chat box, and you can go to that website. It has all those specific dates that I just mentioned. We also put our email in the chat box that you can email any of the staff members involved in the PPAD project through TCHMB, and we'll get back to you as soon as we possibly can.
All right, it looks like we have a question in the chat from Wendy Bolton. And the question is, for those facilities who utilize an OBED to triage all perinatal patients, how do you see the data collection for patients in main ED? Or would we collect data from OBED?
This is Amanda Day from United Regional in Wichita Falls, Texas. I'm North Texas RACC. We would be doing, we will be doing both. We're somewhat doing both right now, but we have an OBED, which already has reports built where I can track those patients that are arriving to the OBED. And we're working through using my quality abstractor to help build reports where I'm pulling, I'm going to start pulling that also from our main ED. But that's after we've kind of established a collaboration between me as the L&D manager and Heather is my counterpart for the ED. She's the nursing manager down there. So she's kind of helping facilitate how to get their quality person and my quality person to pull the right data for us.
I think that's thanks, Amanda. That's an important point, because I think there are other hospitals that have a main ED and an OBED. I know that's how our hospital functions in San Antonio, at least one of our hospitals. It'd be important to share your information as you've done, Amanda, with the group. And I agree with you in the way that you decided to keep those two separate. Because one of the other things that we do want to see is, how quickly those patients are identified in the ED. We want to look at whether they're being treated appropriately, how quickly they're being treated, and if there's any collaboration with even the OB who may be not on the same floor, but in the same hospital that has a OBED and a main ED.
And Amanda, it looks like there was a follow-up question for you asking, do you receive many postpartum patients in your OBED?
Yes, our OBED is the main part of where our community shows up for any kind of pre or postpartum care. But that's partly because we advertise that way, very much so. So we have about 3 different clinics and a couple of private physicians that do OB in Wichita Falls. So they're very good with telling the patient, if you have anything that's going on with your pregnancy and we send you to the hospital, you're going to arrive on this floor at this location. So honestly, for us, it helps that the OBs are telling them which direction to go. Most of our postpartum patients, as we're giving them education after they've delivered, we reiterate that as well. We say, hey, when you get home, if you are still having any of these symptoms, we give them kind of the post-birth warning signs in our version of that. We do the blue bands. We explain that if they've got the diagnosis or any of the elevated pressures that we've seen. So they're pretty well informed to come back to us in the OBED first. But there are a few that transfer in from outside facilities or that maybe aren't sure because there's some different barriers like language barriers or something. And those that arrive to the ED, that's kind of where we're at right now, is making sure that the ED physicians know that doesn't have to be their burden. They don't have to bear that cross. We want to. So as soon as they see those patients, to call us first so we can help get them to the right spot.
Hey, Amanda, just a follow-on question, and again, thank you. Is there a limit on when a patient can show back up to your OBED? And I give an example. One of the questions came up. Patients who are up to 6 weeks postpartum will return to the OBED as opposed to the emergency department.
Yes, 6 weeks is where we have put. Actually, you know what? I think when we changed our policy just a few months back, I think we upped it to 8 weeks. But we do tell them for the next 8 weeks, this is where you would show up. But we also have a caveat to that for our staff that work the OBED and the L&D unit. If they show up, no matter what gestation, we're going to figure out what they're there for. And we're a smaller facility so that we can still handle that as far as staffing and support and that kind of stuff. so we can manage that if they show up and they're past that 8 weeks, or if they show up and they're not even delivered yet. Like those are the things, or they're not 20 weeks yet. We can kind of handle those things with the numbers that we're seeing now. But 8 weeks is where we had changed our policy just recently to say, make sure these are coming to us, the ones that are delivered and then post 8 weeks.
And there are still probably other patients who are people that will show up in the main ED that are in that 6 to 8 week period that sort of slip through the cracks, I'm assuming.
Yes. And those are the ones that we're trying to hone in on right now, because we've got a pretty good, at this point, process with our OB hospitalist group that runs our OBED. That's working really well when the patients show up to us. So now we're trying to hone in on those that maybe missed the message or forgot where they're supposed to show up, and they're showing up downstairs. Ours is a tower over and 2 floors down. So we've got a trek for our patients if they show up in the main ED. But we've got some processes in place too, where if they show up, we immediately receive a call, and one of our L&D nurses goes down to retrieve that patient and bring her back, just based on the fact that she's probably not stable.
Off the top of your head, one of the questions in the chat is, you have any idea how many patients on average you see monthly in that are postpartum patients in your OBED?
We're still pretty low numbers that are coming back postpartum, but I would say probably at least 5. On average, we're delivering about 150 a month. And I would say we're seeing between 5 and 10 maybe coming back in with postpartum issues. It's still pretty low for us, but we're not a big metropolitan area either. We are one of the bigger facilities in our region to do OB care, but we're level 2. So we go down to 30 weeks gestation, and then anything else typically gets transferred out. And I feel like the ones that are really sick that get transferred out to the Fort Worth area, the Dallas-Fort Worth area, tend to stick around that area for a little bit around their postpartum stage, just because of what they're being told. So we're not getting a ton of people coming back postpartum yet. But maybe that 5 to 10, just depending on how busy that month was.
Mm-hmm. Okay, thanks, Amanda. Wendy Bolden, did that sort of answer your question?
Yes, I just wanted to make sure that I was collecting the right data, and I was also working with our ED partners to make sure that we're all on the same page. And our facility is very similar to Amanda's. We do about 150 deliveries a month, and we probably see about that amount back through our OBED. I mean, last month we did readmit 11 postpartum patients for hypertension. So that was a little bit heavier for us, but it's sort of like once you educate out into the community, I feel, and we are also giving that discharge information to our patients when they're discharged about monitoring their blood pressure. And I feel like that sort of increased a little bit, that volume, just because patients are more aware once they get home about what to look for.
Right. Thanks, Wendy. Other questions?
Dr. Hill, this is Gloria. So I'm going over when the hospitals register and the questions that they have in regards to the project. And one of the, I think one that is very common, it says, gaining stakeholders or buy-in for education through the hospital, how they get the buy-in from administration. I just want to share with the whole, everybody attending the webinar, your RAC representatives receive a packet for that, how to introduce the or present this topic to your administrative team. And it was a short presentation, so it can be easy because we know they're pretty busy, so that can help you. I mean, also, I'm not sure we have it on the TCHMB website posted, but it was like less than 10 slides, and it was very easy to present to them, to your CNO, to your CEO, in case that, or your director for OBED, So, so you can have their buy-in of those of you that are still having issues on how to communicate with them. As we saw by the poll, some of them, like 40%, is still, you know, not very good layout of the process with the ED. I know it's wonderful that the hospitals that have an OB-ED, but I know a lot of you have just your ED, and especially smaller facilities, so, or maybe rural facilities. So please stay in contact with us, or you know, on the TCHMB website, so we can share that information with you. I'm gonna keep going over the questions that they have when they register, so I'll bring up another issue if I notice it.
There's one other question in the chat, and I guess anyone can chime in, and this may be useful for all of us. The question is, does anyone have a process to prescribe a patient a blood pressure monitor through insurance, and I guess to include Medicaid, or patients purchasing their own blood pressure monitor?
Okay, what I can say, in some of the hospitals, what they do is the case management gets involved, and then they are the ones that can get the blood pressure cuffs. The Preeclampsia Foundation also, I think you can purchase some with them at a lower cost. I think this is some items that we're going to address also during our monthly calls, and see how we can help you guys. Texas Same also have provided some, so they're not involved here right now, but you know, since we're like working collaboratively with them, they have provided some resources too. But actually, for your hospital, your case manager or social worker can be the ones that can get those items to your patient in the meantime.
Thanks, Gloria. Other questions? And then Mercy, Nagla, I don't know whether we put the information about the race equity webinar in the chat.
Sure. We'll be sending a follow-up email with that information to everyone who attended the webinar.
Okay, sounds good. And just as a reminder, this webinar is being recorded, so you can go back and look at the information. I know that there was a lot of data points and some descriptions of definitions of some things that we think are important. And the recording will be posted on the website, the TCHMB PPET website, but we'll notify you once it's posted. And as Mercy mentioned, we'll be getting a follow-up email out to everyone that registered tonight. And then also providing more information about the upcoming webinars that I mentioned, the next two upcoming webinars. And then lastly, as I mentioned, for those who have enrolled, expect to get to receive your orientation packet in October. And so that should be coming out fairly soon. Other questions? It's 5:59. Gloria, any last minute information, or Lolly, anything lastly that you want to put out?
No, just thank you everyone for coming and joining us.
Ditto. I really want to thank everyone for their interest in this project. It's very important, and we can do it. We can decrease maternal mortality and morbidity from preeclampsia and eclampsia. Thank you.
I agree. Well, thank you everyone for joining tonight. Appreciate your participation. It's been a great discussion, and we look forward to the next webinar. Have a good night.